All right, this is Tess, coming up on 10 here this fall. I started seeing her in October of 2014. She was very, very clumsy, falling for about 6 weeks. They were thinking brain stuff, right? Or some kind of degenerative neurologic disease, something along those lines. She was worsening and worsening, getting progressively worse for 6 weeks. So the situation was dire. Everybody was really, really worried. It took about 8 weeks or so to get her back, which is unusual, because normally I get results quicker than that. But she had some nerve interference in her upper neck, some tension going up into the brain, and then we had a lot of reactions down through here. So I think that the compression in the spine, pinching on the nerves, was making the legs seem very, very clumsy. All right. Now she's been on maintenance for a long time now. I see her about once a month just to keep it safe. We used to get tons and tons and tons of reactions all down through here. This first instrument I'm using right on the vertebrae. It stimulates the nerves. I'm looking for these muscular contractions. So we just get a couple little dinky ones in through the middle of the back and down into the lumbar spine. There's a couple more in the pelvis here. Now this is probably just normal stuff from her living and playing and enjoying herself at home. Do the same thing on the other leg. Getting a little reaction out of her pelvis over here, out of her knee. You're a good girl. Just a little bit of a head bob. We used to get a lot more of a head bob before. So what that means is whenever we get these reactions, it means that there's nerve problems, and we want them to go away, or we want them to reduce as best we can. In her case, both of those things have happened. So just a little bit here, a little bit in the shoulders, a little bit in the pelvis, more like in the wheels. One more pass on the spine. Excellent. Part 2, muscles. She can sit. Another great thing about this technique is they can be in any position. As long as I'm on my spot, they can be doing whatever. So notice we're getting a little bit of action through the mid-thoracic. A little bit of tension in the upper neck. Lower back would pick it up. These are all also the main acupuncture points that we're hitting. So we're really stimulating the meridians while we're doing this too. So we're mobilizing the joint, we're increasing blood flow, we're getting the nerve and the muscle to talk to each other better. All kinds of good stuff happening. Down into the pelvis here. All this leg shaking is not supposed to happen. She's been more active, you know?
Yeah, she's no problems at all. Yeah, she grunts a little bit when she lays down, but
yeah.
she's 10 years old.
Yeah, right, I do the same thing. So. All right, stand up for me. Let me get her other side, and I'm going to do one more thing, Jeff. I added in some magnetic therapy since I saw you last.
Okay.
So we're going to do that next. Basically, magnets bring nutrients in. As soon as you put tissue, a living tissue on, it brings in blood, nutrients, oxygen. When you spin the magnet, it increases the magnetic field. So when you do this, we're doing a muscle massage with her, and we're also, every time this magnet hits her and rolls, it's increasing blood flow, oxygen, nutrients into the areas. So anywhere where we got a reaction, we're going to roll. What do you think about that, Tess?
I think she likes it.
Yeah, she looks like she likes it. Watch yourself. She said, why don't you start with this, buddy? Why don't you start with this, huh? You're a good girl. Yes. Feels good, right? All right, just a little Little extra stuff for Tess, right? Little extra stuff.
Is
You
that
get her-
something we can do more now?
You can.
We're getting into this?
Yeah, we'll talk about that.
Okay.
Here, stand up. Stand up. I just gotta get her other leg. All right, we're good. Good girl, good girl, good girl.
That's it.
Good girl, good girl, good girl.
Yeah.